And I know I am definitely lower energy tonight than I usually am.
All right, it is now 5 o'clock. So I'd like to welcome everybody to our meeting this evening. And I want to wish you a happy Pi Day. Today is 3.14. I'm a math teacher, I just had to do that. So I do want to say thank you to all of the members for your continued participation. And I want to thank any community members who might be joining us this evening for tuning in. I'd like to start this evening by inviting you to join me in centering our conversations tonight. First of all, I'm going to read a statement. And then, as usual, I will ask you to join me in a breathing exercise to help bring focus and thoughtfulness to the conversations we have today. So today we convene to listen and learn from and with each other through reflection and discussion. As we reevaluate and improve our public safety practices, we elevate the voices and experiences of the communities who have been and continue to be disproportionately impacted by inequitable systems. We thank all those who have advocated and worked on dismantling injustices in Tigard and our broader community. We build off of their efforts to create more equitable and just outcomes for people of all backgrounds and abilities. The purposes of our meetings is to develop our understanding of current public safety structures, practices, and procedures, to identify and eliminate institutional racism within Tigard's public institutions by centering equity and racial justice, to bring forward the concerns and experiences of ourselves and our community, and to bring recommendations to city leadership to improve the lived experiences of all people in Tigard. Now we are going to do a breathing exercise together. You may turn off your cameras for this portion of the meeting. Okay, wonderful. So please close your eyes or gaze softly downward. Feel the chair under your legs. Breathe in deeply through your nose and out of your mouth. Feel your hands in your lap. Breathe in deeply through your nose and out of your mouth. Feel your feet on the ground. Breathe in deeply through your nose and out of your mouth. You may slowly open your eyes and begin to breathe normally. Thank you very much for participating in this and creating space with me. All right, Kim, are you ready to do roll call?
I am. Commander McDonald.
Here.
Officer Nunn.
Yep. Here.
Shelby Rahala won't be joining us. Michael O'Brien.
Here.
Elise Butera. Emilio Calderon.
Here.
Liz Newton. John Trin.
Here.
Jimmy Brown.
Here.
Lee Landers. Patty Lofgren.
I'm here.
Justin Lowe won't be joining us. Danny Rauda.
Here.
Valerie Sasaki.
Here.
Sean Stoldryer.
Here.
Nick Jarmer.
Here, thank you.
And Jeff Mott.
Here.
And Patty, let's roll.
All righty. I did not see any public comment. Kim, do we have any public comments this evening?
There was no public comment.
Okay, wonderful. All right, so Chief Kathy, I think you're on board first.
I am. Good evening, everyone. So first I'm going to start off with the update in saying that your PSAB recommendation. I know we're not calling it the ombudsman, but that position did get forwarded to the city manager. City manager will have an opportunity to review it and then decide how it fits maybe in the budget process. So just know it was forwarded on. And then before I go into the legislative short session update, I did want to bring to your attention, because we're all about improving and listening to whether or not we meet the needs of our community. And last week at City Council, there was a community member who wished to speak in during the public comment. And it was a complaint against the PD, but so that's ongoing. But the one part that I listened to was her frustration of how she did not feel the complaint process was user friendly, and that she seemed to be passed along. So Commander McDonald and I took that very seriously, and we kind of looked at how we could improve even more. And so we made a few changes immediately that Jamie, if you want to kind of go over very quickly, I'd appreciate it.
Yeah, sure. So a couple of things we did was verify what we already had in place to try and make sure that that was as user friendly as possible. So for example, if I was to Google how to make a complaint against the Tigard Police Department, we made sure that that was that it was at the top of the like your Google search, for example. But one of the things that we identified was that in our lobby, we didn't actually have like a form that someone could just come in, fill out, and then turn in at the front counter. So we took care of that. We created a form very much like if you were filling one out online, and now that's available in our lobby. And then we are doing some reinforcement training with our staff, letting them know that, hey, everyone by policy can take a complaint. Not only can, but is required to take a complaint. And then to remind a community member, there's a variety of different ways. If they don't feel comfortable doing it with the person they're in front of, they can go online, they can fill it out in paper form, they can talk to a supervisor. So there's a variety of different ways that people can make a complaint or to compliment an officer or a member of the department as well. So we're doing that reinforcement training with all of our staff over the next couple of weeks, either a briefing or when they have team meetings or something like that, to make sure that everyone is up to speed on what we have available, and letting people know that we have, something now in the lobby that we haven't had before. So somebody can come in, fill that out, drop it off at the front counter, and leave without talking to anyone if they choose to. So that's what we did immediately, and we're constantly looking for these opportunities to improve, like the chief said. So we were able to pivot on that pretty quickly and throw something new that we just had kind of overlooked.
Thank you. And yeah, the comment that resonated with me is we shouldn't rely on our community members to rely on Google on how to do things. So again, even though we all intuitively, or the majority of us, kind of default to that, we wanted to make sure there were other avenues then, instead of just relying on somebody using the internet to figure this out. So hopefully that will take care of it until we hear a different point of view, but wanted to share that with all of you. Now I will go
Chief, Valerie has her hand up.
Yeah, go ahead, Valerie.
I just have a quick question. So first of all, I think it's great that you're so responsive to the community feedback, because often, how do we know if there's a gap unless someone says something? So thank you for being so responsive and quick to that. One question, is the form only in English?
At this time, yes, for at least the hard copy. Jamie, do you have anything more on that?
Yeah, we're going to work on getting it in Spanish as well. The online version, I haven't checked to see if it translates. The whole website is supposed to translate, and I'll just be honest, I haven't looked to see if that one, if the form translates, but it should. I'll verify it though.
Okay, great. Thank you very much.
Yep.
I just think that would make it even that much more accessible.
Agreed. And I'm also happy to announce that not only did we swear in 2 new officers today, but also a record specialist. And one of the criteria this time around was to have a Spanish-speaking person in records for that very reason, to also be able to assist as a outward-facing customer service to help with our Spanish-speaking community as well. So we're excited to onboard Yvonne in that regards. And then last is the short session. It was very fast.
Chief, sorry. Sean has his hand up.
Okay, go ahead, Sean.
Oh, sorry. As you guys were talking, I started filing a complaint. I got it through Google and through the city police website. It wasn't that difficult. But Valerie's right. I think we should have an option for a Spanish complaint form and to be able to find it in Spanish. That's another thing, navigating it to it that way. That's it. Thanks, everybody.
Yeah, thanks for the feedback. Appreciate it. And we'll get right on that. Short session. And I don't have Justin Lowe here to correct anything, unfortunately. We would love his expertise, but I'm going to go through what I only selected, what I thought kind of may or may not resonate with you. These are certainly the ones that Oregon Associations of Chiefs of Police and Sheriffs focused on. There were many, many more, but I also am only presenting the ones that passed and are sitting with the governor. Next slide, please. And I'm going to lower my screen so I can see it all. So again, this is 35 days in the short session. It's really designated for legislative leadership to limit the number of bills in the session to 2 per legislator, 5 for the interim committees, 5 for the governor, and 5 for judicial branch, where the longer session can be as many as 4,000 bills. Short session was originally intended to handle adjustments to the state budget and to consider necessary fixes to legislation that was passed during the long session. But we're seeing an increasing number of bills were introduced and considered in 2022. Next, please. So the first one is truly a fix. If you recall, I brought up the crowd management. So they cleaned up some language, defined what crowd management means, kind of replaces a declaration of right as a trigger and using the objective reasonable standard, which is what we use for everything else, our use of force, if you recall. And also define when tear gas can only be used. And you can see I won't read everything. And then there were some several technical improvements. So again, as law enforcement was looking at how do we abide by the law, we needed definitely some language cleanup and some further clarification. So as it relates to tear gas, it requires a commanding officer to authorize the use of it, requires an attempt to de-escalate the situation or other alternatives to force when reasonable without success before using tear gas. Requires that an announcement be made at least twice prior to deploying tear gas, and requires law enforcement to allow sufficient time for people to evacuate. Also requires a provision to notify emergency room if you're going to use chemical incapacitants, tear gas, and kinetic impact projectiles when used in a crowd. So this is not the one-on-one individual that most officers, this is definitely in a crowd management. And of course, any law enforcement can actually make their policy stricter. The other thing it clarified is emergency vehicle sirens, because there was a sound provision in there, and it doesn't prohibit us from using just emergency overheads and sirens in a police vehicle that they're talking about. And this measure also authorizes the Commission on Statewide Law Enforcement Standards of Conduct or Discipline to hire an executive director and support the staff. This was again recommended in the long session, and it'll be further. So it passed the House and the Senate and is pending the governor's signature. Next one. This one, restitution. It's probably good for you to know that they put in a 90-day timeline for district attorney on behalf of victims to file for restitution. Pardon me. and ensures that restitution for crime victims is collected prior to any court fines and fees. Next slide. So they did put a moratorium on the number of OLC marijuana production, process, wholesaler, and retail license. So it prohibits them from issuing new ones until March 31st. Any that they expired or relinquished can go ahead and get up to date, but any new ones, they put that on hold right now. Next slide, please. This is not as important or impact kind of the metro area, but a lot of the rural Oregon has had problems with human trafficking and sex trafficking as it comes to marijuana workers. And so they put a moratorium on when the enforcement grant was going to sunset. There's a lot of Oregon State Patrol and some of the sheriff's departments really relied on that funding. And so it keeps it going for a period of time. Next slide. And this is probably the biggest one that was in the last session. Senate Bill 1510, it had died. It was basically everything but the kitchen sink when it came to public safety measures. A lot of wide range reform provisions. It didn't pass. This one was a modified version, and probably the most important out of the 18 pages is that regarding traffic stops, one headlight, one tail light, and a license plate light violations are secondary offenses. And then it goes well into how to do consent to search, which many of us were already following, but it kind of institutionalizes everything that you have to get in writing, preferably in body worn camera, that somebody consents to a search of their vehicle, and how to basically go about getting that consent and making sure it's voluntary. And again, pending the governor's signature. Next slide, please. All right, so a short session, but was impactful. It was hopping. And I think we worked very hard with the legislature on giving them information as they were deciding whether or not to vote on some of these legislative bills. So happy to try and answer any questions that you may have.
No, oh, Sean, please.
Hey, Chief, there was an article in Coin News. Tigard sting operation leads to arrest for child exploitation. One of my neighbors mentioned that, and I had to look it up. Otherwise, I hadn't come across that. Do you have any comment? Well, first of all, thank you for that participation, keeping our community safe. Do you have any comments to add about this case, this issue?
Not specific to the case. It was definitely a federal case. And when they go out into the community, they try and work with the local jurisdiction. So they did that with us. They used our facilities for briefing. They asked for some resources like patrol cars to, visibly when they were executing the arrest warrant, and then asked us to help communicate the arrest to the public. So our role was pretty small in this, and it was mostly led by the feds, but they like to rope in the local partners as well.
Okay. Well, thank you. Great work. Very great
Absolutely.
work.
Yeah, and I don't know, Jamie, if you have anything, it was his kind of unit with investigations. If you have anything more to add.
Really just that when the feds go after someone like that, this is generally somebody that we absolutely don't want in our community. This person was a person that needed to be in custody before they could victimize someone else. So it was great partnership and excellent work on on the part of everybody involved. But yeah, it was almost exclusively a Department of Homeland Security. The Homeland Security Investigations is who led it and who we worked with on it. So yeah, it was well done though.
Great. Thank you, Commander.
And that concludes my portion, Kim.
Thank you, Chief.
Thank you, Chief and Commander McDonald, for bringing us up to date. We appreciate that very much. I think now we're going to invite Officer Northcote and Clinician Crystal Fisher to give us a presentation on the mental health response team.
Well, hello. Do you want to go first? I was just going to introduce myself and then have you introduce yourself if you want.
Sounds great.
Okay, I'll go then. So before we get into MHRT and what everything is, I thought you should at least know who I am. So my name is Crystal Fisher. I'm a clinician with LifeWorks Northwest, and I'm the South Cities clinician for the mental health response team. So I ride around with Officer Northcote here and also an officer with Sherwood and Tualatin. We have 2 weeks on, 2 weeks off. Well, 2 weeks on, 4 weeks off, I guess, because it's a 3 rotation. But so I'll let him introduce himself now.
I'm Officer Northcote. You guys know I'm with Tigard. I am her partner. I'm with the mental health response team as regards to with Tigard. Like she said, we work 2 weeks on with each other, and then the other agencies will take 2 weeks as well. So that's kind of what we do. I've been with Tigard for over 6 years, and just since then I went to the CIT course and then did the advanced CIT and got nationally certified by the Anger Management Association, and just kind of doing those things to kind of help Tigard. But Crystal, yeah, talk about what we do.
So the mental health response team is a co-responder model, which many of you probably can tell, but basically it pairs a clinician with an officer or deputy, and we respond to 911 or non-emergency calls that have to do with mental health or behavioral health. We have been in the county for over 10 years, just with deputies. And then recently, I think last year or the year before, they expanded to then have Beaverton and Hillsborough officers join the team. And then just in September, we joined as South Cities team. So it's evolving pretty continuously. I've worked with crisis for 7 years almost. So for me, it was a pretty natural transition. I don't know if any of you have heard of the Hawthorne Walk-In Center, but we work very closely with those clinicians. It's an urgent walk-in clinic in Hillsborough. So often if clients don't want to talk to us, we're giving out those cards because it's a whole other approach. Most of the times if we're going out, it's come in through dispatch. Usually it's a friend or family member calling concerned. Whereas if somebody goes into the Hawthorne Center, it tends to be more self-initiated contact, which both have roles. So it's good to work with that. So pretty much the calls that we get are a family member who's worried about a loved one. They're worried. They sent some texts saying they're going to hurt themselves or hurt somebody else, or they haven't heard from them in a while after they sent something concerning. It could be Facebook posts. It could be they said they're going to go hurt themselves. And so that's kind of what leads our response. Some of the people the law enforcement will have a history with, and I won't know who they are. And some people I'll have a history with in my crisis services, and the officers won't have all the info. So that's one good reason to kind of be collaborative and work as a team, because we can share that information on these crisis calls. And so our goal is to provide resources at the lowest level of outpatient care possible. So We can get people to hospital if they've done something to hurt themselves or we believe they're at imminent risk. But our goal is to have them connect with resources before they need that higher level of care. And I think that that's something we would want to look at, maybe like data in a couple of years and just see how this has helped, because sometimes people just go straight to the hospital when they don't know what else to do if they don't have this resource out there. And so some of the resources we have are gift cards for food, or we have like Fred Meyer gift cards sometimes. And we have to be very thought through of who we give the gift cards to and what for, just because it's a limited resource. But it does help in those moments when somebody like really doesn't have anything to eat and they're just trying to get through to tomorrow. Or we can give bus tickets so they can go into Hawthorne. And we do have a service coordinator who can do phone follow-up for a longer period of time and help people get connected to the Oregon Health Plan or ongoing mental health services and other resources like that. We pretty much see everything. That's just kind of the what we do part. I do have more, but I don't know if I'm missing anything, Joe.
It's such a broad team that we kind of do. And I think the biggest thing we also try to do is not only divert people from the ED emergency room system, which is all bogged down. We also try to divert people from the criminal justice system if we have to, if we're able to. Yeah, I'm a cop and I'm there for her safety, but we're also trying to find the best possible outcome for the client. If they do commit something that's, obviously if it's something that's needs to go to jail and needs to be prosecuted, then that's one other thing. But we're trying to kind of get people from having to be on these services, to not be stuck on the 911 service, to go into hospital services, tying up resources that way, trying to get them linked up with Washington County Mental Health and giving them a week on our follow-up to kind of get them to whatever kind of health care or mental health or any kind of services they might need. Yeah, that's kind of it.
Yeah, I'm glad you added that because that's another big piece. The jail does have mental health system in it, but we don't want somebody to have to pick up a charge initially. You know what I mean? If they're not have a warrant or anything like that, because especially if it's mental health induced, because we can give them other resources and try to avoid that if possible. So our schedule is Tuesday through Friday, 1 to 11 p.m. And that's the South City schedule. So if we are unavailable if we're really busy, county can back us up, but they also get their own calls. So they actually cover county 8 a.m. to 11 p.m. on the days that we don't work. So they are still able to respond. And, the way that we get requested is while we watch the board so we can see which calls are mental health related and if it is appropriate for us to go and just kind of take that initiative. But we can't see everything. So other agencies can call us or call out on the radio. Is MHRT available? Or we do have an email address that officers can email if they've already made contact and there's no imminence, but somebody is just willing to talk to a therapist. We can take those kind of referrals as well. And, we don't have to go out and do an assessment to offer any resources. So if it is not imminent, we do still welcome anything that we might be able to help with later,
In regards to the imminency, we also do get dispatched by the Hawthorne Center from crisis team, can actually ask us to do community response calls.
And we have a question from the chief.
Mm-hmm.
Yes, ma'am.
You're muted.
Oh.
Okay, that was a practice run. Can either Crystal or Joe, can you talk about making sure that people understand kind of the difference between what a crisis negotiator will do and the types of barricaded subject versus what you're going to do where we're not going to put you in harm's way? Can you talk a little bit about that so kind of dispel some of those misconceptions?
Yeah, because the county has CNU and MHRT. I know they're just fancy acronyms, but they mean the Crisis Negotiation Unit or the Mental Health Response Team. CNU specifically is to kind of a peaceful resolution to like extremely volatile situations. Like the chief said, they deal with barricaded subjects who are trying to avoid arrest, hostage situations, threat to self or others, things like that, and a whole variety of crisis events that can kind of lead to like a safety of the community type thing. CNU, they gather information, historical information on people, psychological profiles. They help the SWAT team give like threat assessments, and they work in tandem with the tactical negotiations team, TNT, which is the SWAT team, Washington County. And they don't really do any kind of criminal investigation. MHRT, we are, as like she said, we're a team made up of a crisis clinician and a law enforcement officer, either a cop or a deputy. And then we try to contact the people in need and try to establish like a long-term care. Crystal does in-field mental health assessments. Again, we try to divert people from the the criminal justice system. Again, we, just like CNU, we're trying to attempt to have a positive outcome in emergency situations, but not so much on the volatile, violent side, because common misconception is that the clinicians cannot negotiate. They can't do any of that kind of negotiation, putting weapons down, taking body armor off, things like that. That they can kind of speak through their law enforcement partners, but we are the ones that have to do that. Again, also the clinicians don't really do a diagnosis of subjects under the influence, and yeah, we don't put them in harm's way. They wear a bulletproof vest. Soft armor, but they're not police officers, they're not armed, and we're not going to put Crystal through the door first in a violent situation. So with the unable to negotiate and not having the means to take care of them, like protect themselves in super volatile situations, that's where you're going to get the difference between CNU and MHRT. Is that kind of what you asked for, Chief?
Yeah, no, appreciate it. Thank you.
Yeah.
Any other questions?
Yes, Councilor Newton.
Yeah, thank you. I'm grateful that I've had this presentation being on the council, so I'm sorry I was late. I was at another city meeting that ran over. I was just wondering about the scheduling. You talked about when you're out. Do you look at when your services might be needed the most, or is that not really an issue? You're just available when you're available. I mean, are there more issues on the weekends, or do you notice a pattern like that? Thanks.
The schedule, I don't know that either of us were included in establishing the schedule. I think that was more on a higher administrative choice of when the schedule is going to be. I do know that when we are not on, my county partners will come down, but I don't know that it's any more or less than when we're here. I have heard, and this is not written anywhere, that some people would like it to be earlier in the day. Just, there are things that go on all day. And to be honest, I don't know that if we made it earlier, then we wouldn't have the need in the evening, you know what I mean, or overnight. So I think this is probably the best net. This schedule is the best net. But who knows? Maybe down the line, there'll be another team down here and we can have more hours. I don't know who's talking about that or thinking about that. But things to think about for later, I guess.
Yeah, with our analysts found about between average 65% of the calls in the city of Tigard have a nexus to mental health. And so we do have, with all the follow-up with being dispatched by Washington County, pretty much a Hawthorne Center, and then watching the board here and then taking all the calls in South Cities, like we we're always wanting, we're never wanting of work. Like there's always someone who's going to want us. There's some days that there's 3 consecutive calls for MHRT and Crystal's with a client, and there's county teams coming down to the South Cities as well. I'm not sure anyone clarifies. South Cities is Tigard 12th and King City and Sherwood. That's what we mean by the South Cities. Because everywhere else is going to be allocated by county. Beaverton and Hillsborough sent an officer to the team. And then Forest Grove is sending an officer either to a team or assisting the same way we are. Also, there is going to be a TriMet position as well. So that way the clinician will be with the Washington County units that do TriMet. So, yeah.
Thank you. And Commander McDonald.
Yeah, I was just going to say there actually is a method to the madness, and Joe kind of touched on it with regards to the scheduling. And actually probably we could do it earlier, like Crystal said, and it actually would allow more time for the team to do follow-up, because that, I mean, not to steal your thunder, but they do quite a bit of follow-up work is what a lot of what they do. And maybe talk a little bit about that, Crystal or Joe, like some of the, I mean, because a lot of the stuff that you get isn't just that call for service. It's following up on maybe somebody you've worked with recently, or a referral that comes in from Hawthorne Center to try and connect someone with services, or follow up and make sure that they're using the services that you connected them to. So maybe talk a little bit about that or something along those lines.
Yeah, our follow-up can range. It can range from just a check-in call of, hey, I told you I was going to call you today. Just want to make sure that you're doing okay with what we gave you. Hey, have you had a chance to call the doctor yet? Or did you think about calling the therapist? Something like that. Or, we do have so many resources we give out, like lists of therapists that take the health insurance, things like that. So it can be just following up on the logistical things like that. And like I also said earlier, we do have a service coordinator who can do the more intensive things, like helping somebody get connected to the Oregon Health Plan. So sometimes our role for the follow-up would be figuring out when they can connect, or a lot of times it's not even with a client that we've had contact with. It's about calling a provider, because I said I would call a provider, letting them know that we saw their patient or client. It could also be consulting with Hawthorne Center and saying, hey, I met this client who has a need for housing, but it's 11 o'clock, so I can't call anywhere with them. Is somebody who has more of those skills available to reach out to them? So sometimes it's case management. But for the most part, if the client we saw is not imminent enough to need the hospital, then we if they don't answer our calls after 1 or 2 times, if they said they wanted us to call, we're pretty much voluntary. So we kind of have to give people a lot of autonomy to just choose when they need the help and hope that they have taken the resources that we've given them. I don't know if you can think of any other follow-ups. I mean, we do sometimes go in person.
Yeah. And without being too invasive, we spend a lot of our time with families as well. Yes, we go to in-person crisis calls, and let's say we walk away from half of them. That's not just where we kind of cut the line and just cut bait. If we're still on scene, we're going to be with the family members or significant others, whoever cares about these people. And we're going to try to educate them on the process, the system, also how to assist us or any MHRT or law enforcement going forward. If someone's saying they can't remember the last time their loved one ate or drank, well, let's do like a food journal. Let's like just small little things like that to keep in track. Be like, well, it's very hard for us to kind of just whisk someone away out of their house if they live with people, because usually a family member or loved one's going to force them to eat. It's just simple dynamics. But if they keep a food journal and be like, I literally haven't seen them, they haven't had any water in 4 days or whatever have you. Be like, okay, well, that's obviously a very big deal. Also, keeping actual written track of suicidal statements. Last week they said this vague offhand statement. well, what was it? Well, I don't remember. Okay, well, let's moving forward. Like this person's mental illness is not going to go away, and if they're going to continues to be in their family because they are loved ones, they need to be educated and trained on how to move forward, and also to make sure that they get in their own self-care as well, because just same with law enforcement, we can't help others if we don't help ourselves. So we try to train the families on how to, Crystal's huge on that. Take time for yourself in the day. You're not gonna be able to help these people if your family members if they don't help themselves first. So that's another thing we do aside from all the other kind of follow up. We also will touch base with families and see how they're doing, again, without being too invasive, because obviously autonomy and HIPAA and everything else, but just as like a general, just good moral stance and just trying to be good people. We try to check in with them and make sure everyone's still doing okay, even if they don't want to talk to us, be like, hey, this is kind of where we're at. We're going to walk away, but if they have any questions or need their own resources or their own support, they can contact us as well.
Thank you. And Valerie.
So first of all, I wanted to thank you, Officer Northcote and Crystal, for doing this work. I think it's so important. I was just speaking with my sister this afternoon, who is a nurse at one of the larger emergency departments in the area, not in Washington County, unfortunately. So she was talking about the situations that arise when services like what you're providing are not available. People being brought to the emergency department who are in mental crisis, essentially. So I guess my concern is that, we have very defined hours, and I understand that it'd be good to have you working earlier. It'd probably be good to have you working later too. So is it a resources question? Is that what's preventing, all three shifts from being covered? Or do you have a sense of that? Because I just, it sounds like really important work and really useful for the community.
To be honest, go ahead.
I was just going to say that's going to be something that's going to be given by the admin. They'll be the ones to decide that. That's kind of out of our decision making. If it was up to Crystal and I, or just me, I would have a clinician full time. I wouldn't have to share a clinician with other cities because obviously Tigard takes the meat of the call load. But then I imagine Crystal doesn't want to work 24 hours a day either. So. But any type of further stuff that can be directed towards Commander McDonald or Chief.
Well, and the thing to remember too is that while this program has been around for over 10 years in the county, this is the first time it's been designated to a specific area down here. So I think that my interpretation would be, let's just see how this goes for a little bit and then see what the need is and things like that. But like he said, I can't, that's an admin question, but we're still only 6 months old down here just in South Cities, Tigard, Tualatin, Sherwood, and King City. So I think we're going to be learning the trends as well, if there are any trends, and probably using that.
I guess that raises another question. I'm sorry for doing two questions in a row here. But what sort of data are you tracking about the calls that you go out on?
We aren't tracking data. That'll be through the crime analyst. Because we will log the Tigard BHI and things like that in our calls, and then we will use a certain mask, like a clearance code that only MHRT personnel in the county can use or supposed to use, and that'll be compile all the data on a larger scale. But I personally, I don't track any of the calls for that, just because it'd be too overwhelming, and that we have an actual person that does that.
Sure. No, that makes sense. All right. Thank you both very much.
Thank you. And Chief, did you want to address something?
Yeah, thank you. Before they kind of get away from us. So yes, it is titled a pilot project. This was unfunded for Tigard. So we were taking asset forfeiture for ourselves in mid-biennium to try and fund this program. I'm always a believer, you've heard me say proof of concept. My hope was that we had 6 months worth of proof of concept, then could go into this budget, next year's budget, trying to fund our portion of the clinician. So it is in our budget packet, along with, we've only have two asks, the professional standards that you're well aware of, that sergeant position, and then our 65,000 for us for our portion of the clinician. Now, Tualatin and Sherwood couldn't even, they didn't have access to asset forfeiture, so we had to wait until they could actually get it in their budget request, and that's why it was a July start date. And so again, I think just like anything else, we have to get the data and show that there is a need. Washington County, thankfully, once we started up our program, said, hey, you know, when they're off, we'll just make sure that you have resources for South City from the Washington County team, which they've done. And then to start it out with, we looked at our calls for service and we requested a more swing shift type team to start out with, because that was where our highest call volume was in these type of calls. And we can all say that there's always these calls 24/7, but to get the best bang for our buck when we were impacted the most was to cover swing shift first. So that's kind of where we're at. The data, though, is because we asked them to put into what kind of calls they go on to, whether they're dispatched to it versus requested by a unit. We'll be able to extrapolate that and not ever worry about any HIPAA stuff. So as long as they put it in the CAD call, we'll be able to pull that information and give updates.
Thank you, Chief. And Jeff, please.
Thanks. I first just want to applaud both of you for how you're not only the work you're doing, but the way you're speaking about the work, speaking about care and service first and foremost. And I think that's a super important mindset to have. So I'm super happy to hear you both speak that way. My question, I mean, so you mentioned it, Officer Northcote, like 65 to 70% of Tigard's police hours are spent on behavioral health interactions every month. And it sounds like there's a CNU team for the most volatile situations. The MHRT, along with Washington County, manages kind of mid-level mental health crisis, I guess, for lack of better way to explain that. I can't imagine that's 65% of the total, that makes up 65% of the hours, just because it's such a small team. So what happens with the rest of the interactions that are BHI that you can't get to? Because it sounds like you're busy, you're staying busy, and you're going from one call to the next.
Yeah,
Joe, let me get that for you, Joe. On that. So it's 65% of our societal calls that have a behavioral health component. That could be a substance use disorder. It can be, which covers mental health. It covers, the thing I always say is we don't diagnose, but if they're exhibiting or they're self-disclosing or their family members do, we've spent a lot of time and education with our officers and making sure that gets in the call. So again, it can be a shoplift, but if they come across and somebody's unhoused, because we also use our unhoused folks too, so it's a pretty big comprehensive bank that comes into BHI. So 65% of societal calls fall into that. Prior to the mental health response team, unless Washington County was available, relied on our officers. So again, which is why in the levy, we asked to get advanced crisis intervention training, because again, this isn't just this team that will handle all of it, and all of our officers need that training. But what this does is bring Crystal into the mix, to have that person out on the streets to help resolve, to kind of almost like the boots on the ground, really see what's going on. The other thing is, and I think Crystal can speak to it, is mental health clinicians are in short supply. And I think as these types of co-responder teams grow, the demand for this type of service and this type of education and experience is in kind of high demand all around. So it is just a concept that has been proven in Washington County, and now the demands have been so great that, for lack of a better term, the South City said, hey, we've got enough work here to bring somebody down here most of the time. And I think you're just going to see, unfortunately, the need grow because we have so many people who have some sort of use disorder.
Yeah, thank you. And I think I know you guys are working through how to track data, and it's only been 6 months, but I think your head sounds like it's in the right place around proving the concept. And looking at outcomes, I think will be super important too, not just kind of who and where and what times, but are the same people coming back needing help, or is it, is it really helping? And I think maybe that can prove the need for broader access to a program like this, and on the other end, I wonder if, because we've talked a lot about if the officers are the best equipped people to handle kind of low-level mental health situations or not, or if it's someone with a social worker background or a higher level of mental health background. And I think looking at outcomes on both ends, whether it's recidivism or crimes cleared or solved or arrests made on both ends, is a good thing to look at as we maybe talk about who are the best people to work on this type of stuff versus like solving crimes.
Well, and I know there's two other people that have questions, so I'm going to be mindful of that. But I also want to say that, something I didn't get to yet is that I think that a lot of the work that we do is modeling. So, there's some officers I've met that are scared, like really don't feel as comfortable with mental health calls as opposed to like a traffic stop or whatever it is they're doing other times. And to me, it's just being able to have those little conversations of, here's how I safety planned with them. It's education everywhere. You know what I mean? It's not just with our clients. It's also when we have two officers backing us up, they're watching us and soaking us in as well. You know what I mean? Sure, I don't know. There's probably better than me out there. I don't know, but it's like, I do feel like the conversation is happening and that it's not, I think it's more help for our clients down the road than just the immediate work that we're doing with each client, if that makes sense as well.
And there's always going to be repeats, but I think the whole goal is to kind of divert these people from having to only interact with, the 911 officer coming to their house, just a new officer every single time, or going and tying down beds so they don't need to. And then also like the biggest, like you said, it's more of like outside of data driven, more of just like the experience kind of it. It's the individuals who are kind of believe the system's broken. Like they need one specialized type of mental health services, one type of therapist, and they just can't get that. They just couldn't get it once, or they tried it once, and it just, now everything's a fail. Now they can never get any kind of help again ever, and they just feel defeated. When we show up, we're not going to fix everything. We can't fix everyone's problems for them, no matter how hard we try. But giving them access to these service coordinators and giving that one-on-one type of assistance for a week to kind of assist them to kind of navigate them through the crazy web that is mental health, of trying to get services, they can kind of give them that avenue of the certain like specialized type they need. And so that's kind of the biggest thing I've seen just by 6 months of doing it. So yeah, you'll have the repeats. That's going to happen, but it's the ones that don't come back because they got the help they actually needed and wanted in the first place. Those are kind of the success stories to me.
Sean, please.
Well, first, thank you both for what you do. I do think there's a high need for help in this arena. Several years ago, I had a friend go through nursing school, and she became an ER nurse and used to tell stories about just the chaos and the stress and the danger she felt. And she wasn't very big, 5'2", and I didn't really know what to think. I didn't know her perspective. And then, a year or two after that, this was a couple of years ago, I found myself in need of needing stitches in my finger, and I had to go to the ER at like 10 o'clock, and it was absolutely bonkers. People were screaming. There were multiple confrontations going on. People had to be restrained. I mean, it was nuts. And I don't think that's changed. I think this is pretty, this is just what's happening in our ERs and some of the issues that I think are being responded to. So thank you. My question is, do either of you know your annual budget for this program? It kind of speaks about hours and resources and how much help you have to do this.
Right now, we pay between 3 cities. We pay the clinician salary, and all of us commit an officer to that. So, and some of them had to get their advanced training. So there's a commitment in that regards as well. And then King City could not pony up personnel, but they bought Crystal her vest. And so, yeah, right now it's really 3 cities putting the bill for the clinician salary, and then our officers' time to be dedicated away from being a call responder to being proactive in responding to anywhere in the city or any of the South cities.
Okay. Well, just sharing for those of you that are going to advocate for this in the future, or I don't know what this committee will do, but I was just reading that, I don't know if you guys have heard of the City of Eugene Cahoots program. They have a population of about 130,000, and they have a budget for this of about 780,000. And now Washington County is roughly 4 or 5 times the population of Eugene. So anyways, just for some perspective on maybe what could be an aspirational goal for resources. Resources cost money, and it needs a budget. So I have no idea how any of this would get paid for. Just throwing it out there. And I did have one other comment. Has there been any discussion about uniforms and how the team is perceived on the calls?
Well, my partner talks about that all the time. I do look like a cop when I'm with them. I wear a vest. It says clinician on the back. We wear a similar vest. I don't have any weapons at all. It would be nice to wear plain clothes to kind of change that, the dynamic when we go with clients, because I do find myself saying, I'm not a cop, because they want a clinician, or we've said there's a clinician here, but then you look just like them, you know what I mean? So, but I don't know exactly where. I think I'm not allowed to because of the uniform code for county. And since I'm a subsidiary of county, I think that's their uniform requirement, which is fine, but I know we have talked about that.
Well, just worth a thought, because you're there instead of a bunch of police officers, because you potentially have an issue that won't escalate. You're trying to diffuse, and some people would just see police and, okay, well, here's someone to battle rather than a friend, a neighbor, a nurse. I don't know. I think people might react to that image a little bit differently.
And that's what every one of us have said too, but it's ocean hitting a cliff. It's the Washington County Mental has the final say until the higher ups want to change it. So.
Well, I think you guys need matching hats and matching jackets with, like, I don't know, smiley face or something. I'm just spitballing.
She can't talk out of turn on her uniform requirement, and I can't either as well. So that'll be something for you guys to discuss with people in other avenues.
What I will say is it is a common concern what you're bringing up, though. To be fair, the way that we talk to the clients, it doesn't seem to be a huge issue yet. I haven't seen anybody not talk to me because I look like a cop or get super upset. I wouldn't know, honestly, but I've not had any negative reactions or anything like that. And I also, especially with teens and kids who don't really know the system as well, I always show them, like, look, I don't have anything, and it says clinician back here. So try and be on their level with it, you know?
One of the biggest tools we have is trying to have people forget that we're in these uniforms, trying to just talk to them like human beings and the way we position ourselves, how we stand. Like she said, when other officers see us on duty, on shift and talking to the people, hopefully they can kind of see how we mirror the clients and try to just let them forget that we're in these draconian uniforms. So.
Okay. Well, great answers. Thank you.
Thank you. And John, please.
Yes, but thank you, Crystal and Officer Northcote. I think I applaud you for the work you do. I think people with mental health challenges, folks are dealing with lots of houselessness, drug addiction, behavioral health challenges, and so forth like that. So it's a lot of work, and so I appreciate and applaud for the work that you guys are doing. I also want to applaud the city in terms of and the other cities that are pointing up for Crystal and the officer to really take care of the south area of the county itself. Just one clarification. I know that the last time we talked about MHRT, they were saying that the budget increase, is that for the budget for the sheriff's side of the MHRT, or is that does Tigard get a piece of that to help out with the MHRT needs?
That's just the county side when they're talking. We right now, the South cities are funded. Both of those cities by their budget, and ours will be coming up for consideration.
So since the county is funded, how often are MHRT from the sheriff's side of things are reaching into the south area of the county?
I can snag that, Chief. Actually, reasonably regularly, John. They're coming out here on the times when we don't have a clinician working or an MHRT unit in South Cities area. They will call for those teams. The challenge is that countywide, that resource is just even that much more stretched. So sometimes they're not available, which was the biggest reason that we chose to do this.
Right.
But yeah, when they're on their days off, like today's a day off for Crystal and Joe. If we need MHRT, then the officer or the supervisor is going to call and see if they're available. And if they are, they're going to come down to Tigard or Tualatin, Sherwood, King City. So that resource, if it's available, will come out. But it's dependent on, call volume.
Right. And I know that in terms of in Washington County, it's great that we have the walk-in center at the Hawthorne Center for mental health crisis. Unity is a little further away in Multnomah County in terms of for more psychiatric beds, that kind of stuff. I know that we don't have a detox or a addiction center within Washington County. I know that the county is building something, the Center for Addiction and Triage and Treatment. So that's coming down the pipeline, but it's not soon enough. I think it's probably 2 or 3 years away. So in the meantime, what is the PD or MHRT for the South Side are doing around addiction?
So I'm glad you asked that, because one of the resources that I've actually been utilizing a lot more over the last couple of weeks is referring people to Hawthorne for substance use treatment referrals. Obviously, I think you're asking more specifically about actual detox, which maybe Officer Northcote can talk a little bit more about that, because we just have to use the hospital. But that typically we aren't necessarily being called to those calls, because I can't assess somebody and get a true assessment when they are intoxicated. So the likelihood of me going out to those calls is a little less. Not that it doesn't happen, but the likelihood of them actually needing detox level on the calls that we're responding to is a little lower just by nature. But one of those resources that I didn't mention earlier that we do have access to that we can case manage is the Hawthorne Center substance use team. So they can do things remotely by Zoom. Clients can go in there. We have a contract with a cab. So clients who don't have access to their own vehicle, or maybe they're using substances to the extent where they really shouldn't be driving, then we can get them there to the CADC, Certified Alcohol and Drug Counselor, who can assess what level of care they need in that moment. So we do have options. And I mean, I do know of some of the outpatient resources that are available. that I can give people in the moment or their family member to look into at another time?
Yeah, in regards to a type of like detox, all we have available to us right now is going to be most likely Meridian Park, closest ER. And that's obviously the last case scenario. We will try to find a responsible adult before we take them to the hospital. Just signed up for today for a understanding addictions and substance use disorder training that's going to be holding a couple months. So with those other resources that we had prior that are no longer available, I'm just going to have to go and try to find the best ways to get myself trained up on try to fill in that gap and kind of assist just all the persons that we have contact with the best we can until, like you said, those facilities can be kind of rebuilt in a couple of years.
Thank you.
Jimmy, please.
Got that part. And let me get the other part. Okay. Just a big shout out to Crystal and Northcote for their conversations tonight. I mean, I think this has been really eye-opening. And I had some earlier questions, but then folks started answering those, so I came up with some new ones. So I'll go away from just the questions and really kind of make a statement. You know, the national focus has been on mental health services, mental health situations not being a province of law enforcement. And that as a result, you know, we need to really focus on limiting the opportunities that law enforcement community has to deal with folks who are in mental health crisis. And that's something I'm very supportive of, because I know that those situations can in fact get inflamed, and the more inflamed they can get, then the more reasonable conversational types of interactions rise to a level where something else may end up happening. And that's when we get the videos and whatnot showing someone having some issues where law enforcement has to use different tools to deal with them. I know that, you know, legislatures are limiting the certain types of situations that they want to see law enforcement get involved in, like looking at issues of tail lights and, you know, license plate lighting and whatnot. And again, that's what we're recognizing, is that there are certain situations that law enforcement doesn't need to be engaged in order to be viewed as public safety oriented organizations. That being said, I think, one, you know, it's these kinds of services that we're listening to today that need to be part of what I would call, and I please don't take this wrong, please, what I would call a differing use of public safety funds, uncoupling some types of public safety funding from its traditional methods to methods like this. If that sounds like a roundabout way of saying defunding the police, again, recognize I'm not saying that we want to defund the police, as we maybe want to look at increasing the types of utilization of funds that we have historically used for public safety. That being said as well, this is a collaborative approach to dealing with a critical issue inside of our communities. And as such, we should not look simply at the budget of local law enforcement organizations to fund these kinds of services. because public safety is much more than just the police. There's a public safety component to the local hospitals. You are saving the hospitals time and space by not having to use their ERs. That's a financial resource that, in effect, by your pulling folks away from the ER, it's saving the hospital's resources. And then they can put that money into something else. Why not take a look at that and utilize those cost savings to help fund these kinds of services? And going a little further, insurance companies. Insurance companies are another somewhat cash resource for these kinds of programs, because when their clients, the insurance company's clients, are in some type of crisis, where are they going to go? They're either going to end up in an ER, or maybe they're going to be faced with services from you folks. And so I start looking at this from a funding pyramid or funding perspective and saying, we need to be more inclusive with who we are asking for resources relative to this. And then, Chief, also, does the state's marijuana funding program, does that not also attach itself to mental health services as well as addiction services and things like that?
I don't know the specific rules, but I think it goes into that because I think, as I think John Trin alluded to, is the Washington County CAT. And so where can various funding sources go? And I think some of the marijuana tax will go to fund that. I know that, there's also the opioid possible lawsuit. And if we were able to get any funding, we were going to probably put it in CAT as the Washington County. So I think to your other problem, Jimmy, is I think we could all agree regarding who should be responding. Police and fire are just 24/7. So when you start building these models, like the first thing you said was, why isn't there, we need more teams, right? We need more out there. So to be able to address 24/7 is resource intensive. And then I think where cities fall short is when they stop one and fund another without a bridge. And so if you turned around today and said, okay, police are not going to go to X, Y, and Z, but yet we haven't stood up the resources, then all that's left is our community to deal with them. And so, for example, when we have calls for service right now in our downtown corridor, because our unhoused and unstable people are dropping their drawers and defecating in a business, or just knocking over displays and stuff like that, they call us. And if we say we don't come and there is no resources, so I only caution as we decide what we want, who and what to respond to, is please don't do anything without a bridge plan to transition one over the other.
And Chief, I agree with you. I think part of this state's mental health services decline was when the feds deinstitutionalized the mental health system and rolled folks back into the community, but did not bring the bridge funding with them. And as such, we ended up with a lot of folks who had been housed in the state hospital or some of the community-based organizations that were available at that time, and they came back out with no funding sources attached to them. So I don't see this as an either or situation. I see this as a both. I see this as, if the services that we see being provided here are part of a necessity, which I believe they are, then it behooves the different jurisdictions, municipalities, to look beyond just saying, well, if we take it from this pot over here, then we can't have it with this pot over there. And I believe that in reality, yes, we can. We have to plan for it. We have to identify potential funding sources. And one thing I will say, and this is, excuse me, certainly on a statewide basis, throughout the pandemic, interestingly enough, businesses in Oregon thrived. As a result, the business income tax in many of our cities increased because business actually was good. Yes, there were businesses that failed, but overall, the state has increased its surplus. And I think that probably works its way down to the local level. So I would suggest that municipalities like Tigard, Tualatin, Sherwood, Washington County, look at their business income tax and ask themselves, are we receiving as much business income tax as we need to provide services inside of our local communities? Because they are certainly getting the infrastructure utilization, whether it's traffic, whether it's police services. It would seem that we should be able to take a look, and I'll say this for Liz, Liz, because this may very well be something that city council has to look at. Can we examine what that business income tax rate is and utilize it, if we can increase it, for specific types of services? To use that business income tax to fund these kinds of programs. And I know that certainly the business income tax funds a lot of things in the city, but again, this says to me that it's worth somebody looking at beyond just a pilot program. Okay, thank you.
Thanks, Jimmy. Sean, please.
All right. Jimmy, while you were talking, I was taking note and crunching some numbers. The Oregon kicker this year is 1.9 billion being returned to taxpayers. The city of Eugene has a population of 168,000. Portland Metro is 2.5 million. The Cahoots budget is 780,000 from their website. So just crunching the numbers and prorating this, the need for the Portland Metro to have a sizable program, and I'm just using Cahoots as an example because it's nationally known as a successful program, but it's 11.6 million to fund that at the same level, which is 0.6% of the kicker coming back to taxpayers. So I'm just throwing this out there. It seems like the money's there, but it needs to be solved at a legislative level. And I know there's some people on this committee that are very good at those kinds of things. Valerie, hint, hint, hint. Thank you.
Thank you, Sean. Chief, did you have a reply to Sean's comment, or should I keep moving through the order?
Well, just thank you for allowing me to respond at least one while it's on my mind. You know me too well. And just so you know, I have talked to Chief Weiss from TVFNR, and they're looking at, we talked about Cahoots because that is an EMT led and social service provider. So it's not led by the police, and they're looking at different models themselves. And so that work is ongoing. I'm certainly not going to speak out of my lane or promise anything, but I just spoke to him end of last week, and he's looking at various things. And Portland itself has their version of the Cahoots model. So it really is. And I know Washington County looked at it originally and committed to just enhancing the MHRT model at this point, but I know they're in further discussion. So I think as we all look at different ways of attacking issues, those conversations are happening.
Thank you, Chief. And Valerie, please.
So I wasn't going to say anything, but both Jimmy and Sean mentioned my absolute favorite topic in the whole history of topics, which is local taxation. So I can't help myself. I'm just going to leap in. I'll say that the 2022 budget did do some really interesting things with respect to social services, and I would commend it to anybody's reading. We don't have a local business income tax in Tigard. And so we can't, and honestly, I can't imagine a lot of the voters being supportive of something like that. When I talk to business owners, a lot of whom are my clients, they're looking at the burden of taxes they have right now and the totality of the taxes that they have right now. And they're trying to figure out how do they juggle staying in business and, achieving their financial goals. And so that's a challenging situation. And, so a lot of the programs that we look at in Tigard are funded by property taxes. And so to the extent that we were, going to go farther down this road, which is probably a little outside of the scope of this group, although it's certainly within the purview of probably budget committee, I think that it would probably be through a property tax mechanism rather than implementation of a new tax regime, because if nothing else, administration of that would be very, very difficult because you'd have to build all of the infrastructure to make that happen. I saw the mayor's post on the jurisdictional challenges with Hull Boulevard. This is one of those areas where there's overlapping state and local interests as well. I don't know that mental health resources in Tigard is going to be as big a priority for Salem as it is for us. So, this may be one of those solutions that, or these challenges that require local solutions and require people to be creative. But I'm more than happy to talk about local tax until the cows come home. But I think we probably should move on and let Crystal finish her presentation.
Yes, Valerie, I think we can agree that local taxation is probably outside of the purview of this committee, although an interesting topic, and encourage everybody to go and talk to the budget committee.
Fascinating topic.
Yeah, there are other city agencies I know that would love to have you. And Commander, please.
So really quickly, and I know that Officer Northcote has to run. I promised him he'd be done by 6, and it's past that time for him. So I do want to give a couple of quick props to Joe and Crystal. They're very modest about the work that they're doing. The work that they're doing is very impactful. And I just want to say thank you to both of you for the work that you're doing. I know I talk to Joe on a regular basis about this. I'm very passionate about people in crisis. This is a big problem. This is a deep problem. And people that experience mental health crisis should not be given a police officer as their primary care physician. And that's ultimately what society has done. Society has decided over several decades that they would, to use Jimmy's words, defund mental health care. And they place that on the backs of first responders, police officers, EMTs, firefighters, and that is not how it should be done. The system is broken when it comes to helping those in mental health crisis, and this is a valiant attempt and a very successful one, at least at this local level, in order to at least try and find that stopgap, at least try and start working towards that solution like Jimmy was talking about, where we create those bridges, where we create those systems that can create those support networks and the wraparound services that these folks need in order to be successful. Because what we know is often, if people have stability in their lives, creating that level of stability can often create that success that keeps them from falling into that crisis mode, that then keeps them from having that contact with law enforcement, and then keeps them out of the system altogether. So it's a much deeper issue than just whether or not police officers are responding to people in crisis. It's creating a support network that keeps them from getting to that point before we have to be the ones to respond, because oftentimes we are law enforcement is the one to respond because of the acuteness of the crisis the person is in. And often it's because they don't have that support network that's kept them effectively from falling. We need to catch them before they fall. We need to hold them up and help them along so that they can actually then continue to be successful. So many of these people, and Crystal and John, they could talk about these way more than I could, because a lot of these people that have that wraparound service, that support network, are going to be successful, and they're not going to fall into that crisis mode all that often. So anyway, I'll get off my soapbox a little bit. I just wanted to say before I let Joe go, thank you. You guys do great work, and you don't prop yourselves up enough with the great work that you are doing. So keep it up. Thank you. And I'll get off my soapbox, Patty.
Thank you, sir. And thank you guys for having us tonight.
Yeah, thank you. Thank you, Crystal. But we'll continue having the discussion. I think it's moved away from questions. So
Thank you very much for joining us. We really appreciate having you this evening.
It's great talking to you guys. Good night.
Good night.
And Liz, please.
Yeah, I just wanted to follow up on Commander McDonald's comments. I too think this is a great program, and I'm just really grateful that the department brought it forward and encouraged us to start someplace. I don't want to be in a situation where we're like, okay, this is too big. I mean, we started with the levy funding for the officers, so they could go in and de-escalate, do as much as they felt comfortable doing, and then bring in this MRT. So I too, I've become a convert to data, talked to the mayor about how I wasn't a fan, and then I got elected. And seeing the chief bring reports for 6 months about what our officers were faced with, led me to make 2,100 calls to pass the police levy and to ask the mayor to be on this committee and to continue to try to find, I think Jimmy said it best, the bridge. So we need to be looking long-term, but we also need to be looking at what we can do, building every day, every month, every week, every year to move towards more of what Commander McDonald was talking about. We need to get, these issues addressed in the way they need to be addressed, that's supportive of these people and helps them get, try to be successful and get in situations where they truly can live their best life. So any bridges we can build, and at the same time looking long term, I think that's important. And I'm also looking under rocks for money. So thank you.
Thank you, Liz. And Sean.
Jimmy mentioned earlier about we used to have mental health centers and they closed. That all got defunded. Depends on who you talk to, but it happened in the Reagan years or whatever. But it seems to me that those things, and I remember being a kid and actually volunteering with my mother. We would go volunteer at halfway houses, which are kind of those bridges Jimmy was talking about. And I mean, so when you have, when me just randomly, we're involved in community volunteer and we're at a halfway house, 30 years ago, I mean, what I see is that in the last 40 years, these institutions, these bridges, these networks have just gone away. They've been defunded, they've been closed, and they haven't been replaced other than to put this burden on our teachers, our first responders, our police department, and they're dealing with all this stuff. And really, I think we all know it's only gotten worse. It hasn't gotten better in 40 years. There's more competition for resources. Stagflation's an issue. So it's not something that we can probably solve. As Liz mentioned, she's looking for money, looking for buckets of money, and this has been a state. This was originally funded by the state and the feds. It was defunded decades ago, and it wasn't replaced. So I want to add, I was not in favor of the local tax idea for funding this stuff. I do think it needs to be solved at a state and federal level for what it's worth.
Thank you, Sean. Any other questions or comments about MHRT program in Tigard? Patty, if you'd like to lead us in our next topic.
All right, Kim. So now we are going to go back to our discussion of the school resource officers. And is there somebody who's going to be talking to us about that tonight, Kim?
No, this is a continuation. Last week, we really only had time for Commander McDonald and Officer Dunn to give a brief presentation. So if there were any questions that had come up in the interim, this would be an opportunity to discuss.
Okay, thank you. Is there anybody who has comments or questions in terms of the school resource officers who would like to pose those questions or comments at this time?
Commander and Officer, I think you're off the hook. Oh, Sean. You're muted.
Sean, you're muted.
Thanks. Just a comment. I want to echo Jeff Mott's comments from our last meeting. There was a significant community involved group that got together with experts, community leaders, parents to talk about the SRO program. And essentially that group did land on essentially the program that Commander McDonald laid out. So it seems like the community had a consensus on that program, and it's working well. So thank you, Commander.
Yeah, you bet. And the beautiful part about that for everybody's info, and I don't remember if I mentioned it, but it's an ongoing process to continually evaluate the SRO program. It's really unique in the way that Tigard-Tualatin School District is doing it with both the Tigard and Tualatin police departments, is really evaluating ourselves and the way things are happening with regards of the relationship between the SROs and the schools, and then the police departments, and then the district as a whole. So it really is kind of a neat setup and a very unique model that we're doing. So the program this year will look different next year, as a matter of fact, just because of what we're learning as we move through this. So I think that's the beauty of having such a collaborative process, is that it's going to continue to develop and evolve over the years. So yeah, really kind of a neat process to be a part of.
And I'm going to just chime in. I think it says something about the city of Tigard's approach to school resource officers, that we still have them in this community when many other communities are trying to axe them. And I think it really says something about our approach and about sort of the background philosophy of the city of Tigard. So that's just, I think, kudos.
Thank you. And Jeff.
Yeah, since you mentioned it, Commander McDonald, how it's an iterative process, are there like official timelines where policies or procedures can get updated, like on a yearly basis, for example, if you?
Yeah, so the district really takes the lead on it, and they have quarterly meetings. So there's a task force that was created that has some city leaders. So there's a city councilor from both Tigard and Tualatin on it. There's different school administrators, people from the police departments, members of the community that are part of this group that provide input. And then it's reported back to the school board, where the school board really then has the opportunity to weigh those changes that might need to be made in the contract. And often it may not necessarily need to be contract related, but just procedure related that we're updating. So, but yeah, I don't remember if it's the June meeting June or July school board meeting is when the admin folks from the district will report back to the school board as to kind of the progress for this year. And don't quote me on which meeting it is, but it's one of those. It's not really on my radar because it's their report back. But we had a meeting 2 weeks ago, and then there's another one in April that we'll be at that kind of talks about some of the steps that we're going to try and some of the changes we're going to try and implement for next year that we're seeing, that some of the adjustments that I think would be beneficial for everybody. So.
Any other comments regarding school resource officers? All right, Kim, so it looks like the next item on our agenda is a conversation about upcoming topics. We don't have anything in the month of May, so you're going to facilitate this conversation about new topics?
Yes, thank you, Patty. So real quick, just want to go over what we have coming up. Okay, can everybody see that? My Zoom's a little slow, thank you. We concluded our review of MHRT. We've just talked to the officers, completed school resource officers. We've dedicated the next 2 meetings to traffic stops. We have Judge O'Brien and Judge Oberdorfer that are going to join some of our traffic officers in that discussion. And then in April, we have tentatively planned for a ballot 110 and legislative update at the conclusion of the short session. And then looking into May, we've got 2 free meetings before our closeout in June. So the topic for today is, what should we use? What topics would you like to discuss during those 2 meetings? So a review of kind of where we've come so far. So this was sent out with the meeting packet. We did Unit 1 introductions. We talked about the Tigard officer's journey. We did hiring, training, as well as performance review and discipline. Spent quite a bit of our time in those areas. In community experience, we did not discuss officer appearance. We did discuss, or we will discuss, traffic stops. We spent quite a bit of time with use of force. And then in other police public interactions, we've talked a little bit about most of these areas. So no knock warrants came up a few weeks ago, community relationship building, nothing specific around the canine department, although interested if there's a specific topic there that folks are interested in. We haven't done anything with the current holding facilities. A bit with interaction data and data review. It has a little bit about immigration, the TriMet system, and then we haven't touched really on the crime lab except as it had to do with the officer involved shooting, I believe. We spent a bit of time lately on the social justice issues. We've talked about establishing a non-police response. We've talked about the MHRT teams, as well as interaction between PD and nonprofits. We haven't talked about the homeless services tax, although we did touch on local taxation this evening. Not a lot of discussion about interactions between Tigard PD. We have not talked about the bail and fine system or advocating for any changes within there. We did not discuss consequences for calling 911 to report normal community activity. Or advocating for the release of offenders prosecuted for activities that are no longer a crime. And in the youth of Tigard, I think we've covered most of this. We've covered school resource officers, relationship building initiatives that the SROs take on, although we have not talked about reestablishment of a youth peer court program or delegation to that Tigard Youth Advisory Council. So opening up for conversation around, are there topics on this list that we have not covered that are most interest to you and that you would like to discuss and perhaps provide recommendations to the city on? And Valerie, please lead us off.
So as much as I would love to spend the next several weeks talking about Metro Homeless Services tax, I think that would probably not be in everybody else's interest. But would you mind putting the slide back up? Because I wanted to talk about a couple of the items on item 4. Well, I guess you don't have to, we can just talk through it. Because one of the issues that's come up recently in the bar is the cash bail system and its disproportionate impact on impoverished individuals and communities of color. And so I would put that forward as a topic to discuss, particularly since we have the judge here to, give us his perspective on things and his experience with those things. Oregon is relatively unique in that it still does have cash bail. I think we may be the only state in the nation that still does that. So, you know, that's something that I would dearly love for us to have a slightly deeper dive into. And I'm also intrigued by this youth court option, but I don't know anything about that. So.
Thank you, Valerie. And Jeff, please.
My comments more around timing for recommendations. I'm you know, open to whatever topics. Anyway, sorry, I'm rambling. Since we're coming up on the end of all these meetings, you know, second meeting of June is our last one. I want to make sure we leave enough time to go through any recommendations that we have and, you know, have proper discussion and vote, because it sounds like there might be one on a mental health response type thing. Maybe there's something on transparency of misconduct or use of force, and, you know, any other topics that we bring up. So I just want to make sure we have time for recommendation, discussion, and voting.
Absolutely. And that's something, if there are more recommendations that folks would like to bring forward around topics that we've previously discussed, and you feel like there's still more to dive into, please draft a recommendation, send it to me, to the group. We can definitely allot time for that. Thank you, Jeff. And Amelia.
Just to agree with Valerie, I would also love to learn more about cash bail. I don't know if 2 meetings is enough for that, just because that seems like a very big issue and we are running a little bit out of time. Aside from that, I would also be interested in learning more about officer appearance. I feel like that would fit more in like a 1 or 2 meeting timeline, since it's a little bit less complicated of a topic. However, I do want to inform the board that it is possible that I will have to miss the meetings in May. So take my suggestions with a grain of salt, because I will be taking my IB test during that period. So I'll be busy studying, but that's just my recommendations.
Thank you, Amelia. I think you'll be graduating in June, huh, too? Yep. And Patty, please.
Yes, back in the day when we had the open house, Chief McAlpine had the open house at the police department, I was very intrigued and interested in the youth peer court. And so, echoing what Valerie said, I would love to have a conversation about where that has gone and what might bring it back.
Thanks, Patty. And Sean, please.
There's a topic on the agenda about removing some of the sentencing for things that are now obsolete crimes. And I just some of these articles about some of the sentences for things like marijuana crimes or crimes where no one's hurt, crimes where somebody's just young. The male brain continues to develop till it's 25 and makes lots of mistakes. And yet some of these mistakes where no one is hurt, sometimes there's no criminal intent. People are getting sentenced to 5-10 years in prison where they're not rehabilitated, they're traumatized. As a veteran, I would say if you think that people deserve a very long time in prison for a mistake, you should join the military and go be deployed overseas for 6 months or a year and see what it's like to be alone, scared, in a dangerous place, away from your family, not sure of what's going to happen. It's a very long time. And I just don't know that we have that context. I was recently nearly on a jury. I was dismissed from the jury. I had more than enough people there. And a young man was in there who had just had a night. He had stolen a car. He had a weapon. They listed off the things he'd done. He just made terrible mistake after terrible mistake that night. And I could only imagine what the years of mandatory sentencing were going to be for this young man who was, other than the color of his skin, he could have easily been my son in a few years. He looked like he belonged in college or on a sports team, but here he was looking at some very difficult time ahead. So I don't know what happened to him. I wish I did, but so much of that stuff is protected by privacy. You know, I feel very disconnected with what's happening other than reading some things and reading some articles, you know, in the news. And I don't know what applies to Oregon and what doesn't. So I'm kind of in the dark on how some of that works.
Well, thank you, Sean. That's helpful. And Chief, please.
Yeah, I think since I did the legislative update tonight, we can take that off. Ballot 110 is just, it really is an issue of the fact that you decriminalize drugs for the most part. And are we seeing the effects of the behavior out there with no accountability? But that space can open up on that as well. It's just been a topic lately of some of the district attorneys. So I think we added it to the list if you wanted to educate yourself on the impacts or the unintended consequences of ballot 110. So, you know, there's a whole nother meeting that could be freed up. Just want to let you know if there are more desires for other topics.
Thank you, Chief. And Judge O'Brien, please.
Thank you. We've had some discussion, Judge Oberdorfer and I have had some discussion with Officer Spittler about the intended scope of his presentation on traffic stops from the police officer's point of view. We'll have a meeting between now and next week to discuss the scope of our discussion and how we follow up on his report and the chief's. At this point, if we only talked about traffic stops, traffic violations, and our court is not a criminal court, we don't do criminal cases, but if we only talked about that, in theory, it could be a very short session, which may please a lot of our members, but we're looking beyond that to kind of an overview of the judicial process and some of the social justice issues that have emerged in reviewing that. And part of that, I will touch briefly on youth court and peer court, because our court had quite a bit of experience with those programs some years ago, and I consider them to be, based on my own experience, very effective programs. So the scope of our presentation is still a work in progress, but it's not going to just be literally confined to minor traffic violations and how they're adjudicated, which itself is a very important and interesting topic. Thank you.
Thank you, Judge. And Valerie, please.
So I just had a request of the judge. When you're preparing your presentation, would it be possible to also talk about court staff education and dealing with communities of color and different socioeconomic groups? I know that the Judicial Division has done a lot of work in this area, and I think it would be useful for people to see, you know, some of the things that you have to take into account when you're dealing with folks who, you know, may not have access to a private vehicle, for example, or things like that. Thank you.
We'll do that. Thanks.
Thank you, everyone, for your input. This is very helpful. It sounds like we want basically a lot more information on the judicial system portion, which is within obviously the scope of PSAP. So we will work on delivering that, as well as see if we can squeeze in some officer appearance, because there was a request for that as well. Stay tuned. And Patty, if you'd like to lead us into the last portion of our agenda.
Yes, indeed. Thank you, Kim. So now we have some time left, our opportunity to discuss events happening in the city of Tigard. Anything in particular that anyone on the board wants to bring forward for a conversation this evening?
I think I mentioned it, but it almost in the end of this week, first part of next week, applications for our community academy closes. We've had 35 applicants so far, so we're excited about. Due to, you know, still kind of COVID restrictions, we, depending on where we hosted, it may be only 25, but just wanted to share that, you know, we're getting a variety of interests, and we look forward to those presentations to kind of continue the education. If you recall, this board spoke highly of those in the past and really encouraged us to start that back up again. So we're looking forward to that. And again, so it's not too late if you know people who might benefit from going through that academy experience. I appreciate it if you send them our way.
Any other comments about what else is going on in Tigard? All right. Patty, would you like me to go into our next steps?
Please, Kim, thank you.
So we just saw this, but it does have one update. There's now an extra free space. We'll be filling those in and getting back to the group on what we'll be doing for the remainder of our time together. In the interim between now and our next meeting on traffic stops, echoing Jeff's comment earlier, if you do have any recommendations, thinking about kind of the wrapping up of the board, anything that's come up in the past that you'd like us to revisit, discuss in this group, provide back as feedback back to the city, please do consider that and send those our way. Don't need to wait till a meeting to make the recommendation. You can send them in between.
All right, are we moving towards adjourning, Kim?
I believe so.
All right, is there someone who would like to make a motion to adjourn?
So moved.
Moved, is there a second?
Second.
Okay, we have a second. Any further discussion or opposition at this time? All right, I think we are adjourned for this evening. Thank you all for coming. Have a wonderful rest of your Pi Day.